I'm Faika, and today I'll be talking about the things that we students do daily, which is typing. Whether it's for assignments, reports, or even chatting with friends, it feels like it's second nature, right? But have you ever felt numbness and tingling in your fingers after long hours at the keyboard? Maybe it's a sign for something called carpal tunnel syndrome. So, what's really going on inside our hands when we type? Typing activates muscles in your fingers and also your forearms, especially the flexor tendons. The flexor tendons are here where we can bend our fingers, and these tendons, along with the median nerve, pass through this narrow space called carpal tunnel in your wrist. Okay, so if there is too much pressure on the tunnel, like from repetitive typing or poor posture when you type or do your work, it can compress the median nerve, since the median nerve is inside the tunnel, the carpal tunnel. And that's when you get the symptoms like numbness or tingling or even weakness on your fingers, especially the three fingers, these fingers, thumb, index, and also middle fingers. So this condition is known as carpal tunnel syndrome or CTS. It mostly affects people who use their hands a lot, like typists, gamers, or even bakers. Okay, so the most common symptoms are usually numbness in the middle, index, and thumb fingers, and also pain in the wrist or even difficulty gripping things. So for students and professionals like us, this can really interfere with our productivity daily. But worry not. It's really treatable, and especially if caught early, so you can actually reduce strain by taking breaks, doing gentle wrist stretches like what I did, and also can use ergonomic keyboards or mouse pads, like some other people have. So some people also wears a wrist splint at night to keep the hand in straight position, which helps relieve the pressure on the nerve. If symptoms get worse, doctors may recommend a test called electromyography (EMG), that measures how well your muscles and nerves are working. But fret not, it is a very safe and non-invasive test for you, just to see if your median nerve really is compressed. I will put a picture of the electromyography machine here. Typing is really something that we cannot avoid forever, but what we can do is protect our precious hands. Remember, take breaks, sit with a good posture, stretch your hands often, and also pay attention to whatever signs your body is giving you. Remember to type smarter and not harder. Prevention is always better than cure. With that, I thank you.